So, in 1 or 2 words, is the medical system broken?
One word, yes.
How would you fix it?
The best way to fix it is you have to revamp the whole system. And a big part of that actually lies in a lot of the reasons why medical procedures are expensive as they are is because medical school is as expensive as it is. College education is ridiculously expensive and it is getting worse. You need to revamp that system so that it doesn't cost $250,000 to learn and train how to do these procedures, so that you don't need to charge $150,000 for this surgery. And you don't need to charge, $300, $400 for an office visit to sit and talk to a doctor to make sure that he can diagnose the right infection that you have. The education system, I joked with someone, the best way would be eliminating student loans altogether. Not eliminating the debt, that currently they're talking about whether or not they're going to do that. I'm saying eliminate the program, whereas if you don't have the education for the school to give you a scholarship or the money to pay for the education yourself, you don't go to college. You learn a trade. Now, that does have its drawbacks, but over time, eventually, if there's nobody going to the college because it's too expensive, the college is going to lower their tuition again. Right now, they don't, because you have a student loan program where, I don't know how your instructors were, but my instructors used to tell me, some of the ones that had been chiropractors for a long time, they went to chiropractic schools $5,000 a year. And then what happened is when you started to get student loan programs and the government was like, well, we'll give you $50,000 a year for college. All of a sudden, the colleges were like, well, you know what? Our tuition just went up to $50,000 a year. So borrow the maximum, give it all to us. The education doesn't change. We're still going to teach you the same thing we taught you last year, but now we're going to get more money for it. And, you can pay it off at the end. And obviously,
That's how
people don't have that money. I was sold a bill of goods and told, when you get out of chiropractic school, your starting salary is going to be in, $120,000 to $140,000 a year. So I was like, all right, that'll be fine. It was nowhere near that. It wasn't even half that. And so now it's like, okay, well, now I have a degree that is extremely specialized. I can't do anything else with it other than this one profession. But this profession isn't going to start me where I thought it was supposed to, because it's not paying the way it was, because the insurance companies don't pay what they used to in the 1980s, which is who everybody that told me to become a chiropractor, that's when they practiced. And some of my instructors that were telling me they were making money hand over fist. And then I look at them and say, well, you're the reason that you ruined it for all of us, because you, in some instances, one guy specifically I know kind of not defrauded the system, but he maximized so much and did so much more because he knew he was going to get paid for it. Then he did stuff that he didn't need to do with that patient just to get paid. And then the insurance companies were like, whoa, wait a minute. We're going to cut back on this. We're going to start paying the doctors way less. We're only going to pay them this much for that procedure instead of this much. And a whole generation of doctors were suddenly like, okay, well, our tuition just went from here to here, but now our pay went from here to here. How are we ever supposed to survive? So the best way to start lowering that is you need to be able to lower how much the procedures cost. Universal healthcare is not the answer, because you don't want an outside company. As it is, you have insurance companies telling you what you can and can't get for procedures. You don't want one single entity. You don't want the government to be able to tell you what you can and can't get for a procedure.
I don't think you want the government telling you anything.
You don't.
What you can and cannot do.
But you had the government, you had legislators. You didn't have doctors writing the Affordable Care Act. You had legislators writing it that wanted to just focus on saving money. If you had the concept of trying to provide healthcare for everybody is a good idea. I like that. Everybody should be able to have access to healthcare, which they do, because you can go in
and just not get paid.
If you walk into a hospital,
we'll get billed, but not pay it.
Yeah, exactly. You'll still get the treatment. If you choose to not pay it, well, that's on them to come after you. But they're still going to treat you. Nobody's going to turn you down if you're sitting there bleeding or you're having a stroke or a heart attack or anything like that. So, but the way it was written, you had so many doctors that didn't participate in it because the reimbursement was so low. They were like, well, I'm not going to participate in this program because I'm not going to make any money. I'm not going to be able to keep my doors open and pay the staff because I have to increase how many people I'm seeing by 50% just to keep the doors open because you cut reimbursement so much. So you need doctors creating your healthcare plan. That's the number one thing, that you'll have a good plan with that. But you don't want your government telling you you're too old for that procedure, so we're not going to give it to you.
So to answer the question then, to fix healthcare, lower the cost of college.
I would say lower the cost of college, which will then lower the cost of the procedures that you're getting because the doctors don't need to charge that much for things. You need to be able to, if you're lowering the cost, because again, you can't have a fee. You can't tell somebody, well, if you have insurance, I'm going to charge you, $250 for this service. But if you don't have any insurance, I'll only charge you $50. That's fraud. That's fee splitting. You can't do that. So if you don't have to charge that much, if you can say, I'm going to only bill the insurance company $50. So if you don't have insurance, it's still only going to cost you $50. That's going to help. That's going to make things better for people. But because insurances will pay a certain amount for certain procedures, doctors are going to charge more for that procedure. So now someone can't get a surgery that they desperately need because the cost of it is so exorbitant because the insurance company will pay for that procedure and they'll pay thousands and thousands of dollars.
So listen, if we want to fix the medical model, it's this. Focus on prevention versus getting sick.
Yeah.
And then the insurance companies wouldn't have to put out as much money because less people would be sick, right? It's about education, stuff like that, and making it cheaper.
And the other thing that they should do is they should stop saying that they're for prevention, but not actually paying for it. They should be paying for nutrition services. They should be paying.
Fitness
you should be
service.
able to go see. You should be able to get a gym membership through your health insurance. Some insurances do that. There are some programs that will do that.
$10 a month.
Right.
Yeah.
You should be able to see a dietitian. You should be able to see somebody that is trained because your most general physicians, like we have some nutrition training. I took nutrition courses, but if I wanted to further that, I had to take a separate course. I had to get a master's in nutrition or something like that. When not a lot of people have the time or money to add another degree, so why not just go to somebody that's their only degree? But why would you not pay for the visit to see a registered dietitian? That they're a specialist. They should be covered. They're healthcare.
Listen, if they want to do it by that, everything should be performance-based. You have these 3 practitioners. I don't care what even discipline they're in. This guy gets results. This guy doesn't.
Yeah.
I'll pay that dude. Right? Like this is now, and then it goes down to like, okay, cool. So like what patients are they getting? Right? Because not all patients are equal.
Right. Absolutely.
But at the same token, at least you can have some metrics where like, well, this guy has the plan. He gives you everything you need.
Yeah.
He sticks with you. He talks to you outside of the clinic.
Yeah.
Well, I don't care what kind of patient you get. That patient's going to get way more probability of getting healthy because they have a support system.
Right.
Or I love what you do there at your job where it's a conglomerate of disciplines, right? It's going to be way more effective than having a chiro on his own or a PT on their own, right? You have that whole mesh.
That may not talk. I mean, when I had my practice in Rhode Island, I can't tell you how many times I would send, every time I had a new patient come in, I would print out their initial report. I would send it to their primary care physician. I would send it to any of the doctors that they were seeing at that time. I never got a single response. They didn't care. They didn't care what these people were doing other than when they went to their own visit. And now, when you have these multidisciplinary integrated practices, you can say, well, I know that my chiropractor knows what my PT is doing, and they know what my pain management doctor is doing.
Or they can go get them because they're next door.
And they can say, oh, I can just go right on. I can, before you come in, if I see that you're coming in, I can look and say, oh, they saw our pain management department, last Thursday. Let me look at that note real quick.
Oh, you know what's better?
See what's going on. Or I can just call them up and say, hey, what did you do with Mrs. Jones?
Or you're eating lunch with them.
Yeah.
And that patient's coming in next. Yeah. Now, what'd you do?
What we do at our office is we have a morning meeting every day. We go over all of the patients that are coming in that day and what they've recently done, what the plan of care is for that person. Are they on track? Are they improving the way that they're supposed to? Are they stagnant? Are they not getting better? Are we going to have to go a different avenue? Are they going to do they need to go see pain management again? Do they need an injection? Are we at the point where we need to talk to them about a surgical option? We do that every day before all those patients come in. Now, if somebody calls and comes in as a walk-in that wasn't on the schedule initially, then it's like, okay, I gotta call up so-and-so and be like, hey, listen, do you have 2 seconds? Can you just talk to me about this patient? Because they just called, they're coming in a half an hour. And I need to know, what did you talk to them about as far as their plan of care? But unfortunately, like we said, not every office does that. And you have doctors, the worst thing is when you have one doctor that really wants to try to incorporate everything that you're doing, but none of your other doctors care enough to actually give them that information. I always tell patients, this is a two-way street. You have to want to get better, but I also have to want you to get better. Because if you really want to and I half-ass it, you're not going to get better. But if I'm putting everything into, this is everything that you need to do to get better, and you're not listening to me, you're not following my instructions, well, you're not going to get better. And that includes me saying, hey, you need to tell me if you don't want to use, our PT, or you don't want to use our chiropractor or our pain management or whatever. You need to tell me what that other person is doing, because I can't rely on them to give me that information.
Yeah, and so 2 things. I think where you're at is the future of healthcare. I think that's how it should be.
I hope so.
And this is what we tell people. People have to come and meet with me before they start the program, right?
Yes.
The money that they give me is not going to make me rich. It ain't going to make me broke. But what I need to know is, number 1, that you admit that you need help.
Yep.
Number 2, I say, like, hey, Matt, listen. So, not everybody is going to be a good fit for my program, right? Space is also limited. Mm-hmm. So I can't want this for you more than you want it for yourself.
Absolutely.
Right? The desire on your end has to be just as big as my desire is for you to get better.
Yes.
Because it won't be a good experience, right?
Yeah.
So it's the same thing in healthcare. And you see that. And I will tell you, as a provider, you treat everyone as best you can. However, those patients that really want it invokes something in you where you want it for them even more.
Oh, absolutely.
And you will take them during lunch.
Absolutely.
You will stay late for them. Versus a patient, I'll be totally transparent, patient who doesn't care, they want to come during lunch? No.
Yeah,
right? Because they skipped 5 appointments.
We're closed at this point. Yep.
You know what I'm saying?
Mm-hmm. Oh, yeah.
So let's switch to society.
Okay.
All right. So do you believe that common sense is missing in society today?
So the first line in my book that I am writing is a quote from Voltaire. And it is, the thing about common sense is it's not that common. I do not feel that common sense is evident in most of society at this point. People are not thinking about reality. They're living in fantasy worlds. They're living in their, the life of clicks and views. And I just need to get people looking at my social media. I don't care if anything that I say makes any sense, because even if I'm an idiot, people will watch me and laugh, and that can possibly be monetized. No one thinks logically. The very first tattoo that I got was, it says Fudoshin, which in Bushido, in martial arts, is not, and we know this because we've taught it, not fighting while angry. You have to stay calm when you're in a fight, because when you let your emotions go crazy, you can make mistakes. And in reality, or in real life, it's the concept of not making decisions based on emotion, making decisions based on logic and reasoning. And I got that as part of that tattoo to remind me all the time to take a step back and say, let me think of this logically. Should I be doing this? And a lot of times it's like, you know what? No, I'm not. I was using emotion. It happens in social interactions. It happens with, posting things. I can't tell you how many times I have had on my Instagram a story that I was about to post and commentary, my own social commentary about whatever it was that I saw that I wanted to share. And I said, no, I'm just going to close out Instagram. I'm not doing this right now, because my common sense took over. And I said, this is probably not something that I should post out in real life, because who knows where. Listen, I don't have the money to ever run for president. I don't have the money to even run for local office. It costs so much nowadays to try to make a difference. But we're in a society, we're in a generation now where we are going to have at some point in, I would say, the next, right now we elect pretty much people that are in their late 70s. So maybe we go a little bit younger. But I would say in about 4 election cycles, we're going to have people that will have Facebook profiles that the media will pull out and say, look at what this person posted when he was 21. We need to cancel him now. I don't want that to happen. I don't want people to be able to look. I mean, I don't have Facebook anymore.
You think they're going to be checking my MySpace?
I think if they can get the code to find it, I think that MySpace, they'll be like, yeah, look at who he had as his top 8 friends.
But Tom will vouch for me.
Tom will vouch. Tom is living. I saw something. Tom is living like in some island now.
As he should.
He is loving life.
He has the most friends in the world.
He is. But yeah, I think that common sense, people are doing things now without understanding what the consequences will be at a later date.
Well, I think
common sense is gone.
Yeah, and I think that this is uncharted territory. Like social media changed a lot of it. I mean, even when I talk about common sense, though, you see it now because the internet allows for other narratives to be shown or be told other than what the news gives you. Right? That's been a huge.
News. I tell I would plug. I'll plug something. I don't think anybody else. But there's a website. You basically sign up. It's like an email. It's 1440 News. 1440 News. And it is the only news avenue that I found that is 100% unbiased. There is not a single adjective whether they say that this is good or this is bad. They simply say this happened. This bill was just signed. This just happened. That just happened. There's no agenda. There's no reason. News. Now, all mainstream news that you get is biased one way or another. And that's not journalism. That's not, I don't want to know whether
that's soap opera-ish.
Yeah.
Right?
I don't want, and they do it. Why? They do it for likes. They do it for views.
Sure.
They do it for issues. They want to get ad revenue. I mean, nowadays, you don't have, I can't tell you the last time I don't watch live TV. I watch everything on streaming services now.
Most people don't.
Right. And so now the only way you're getting any ads is who bought ads on Hulu. And I don't feel like paying for the ad-free Hulu. Now Netflix supposedly may start with ads during during either binging TV shows. I don't know if they're going to do it in the middle and do ad breaks in movies yet, but I did hear that Netflix is going to start doing ads. And during, I would say, because this was a midterm election this past November, almost 80% of the ads that I saw on Hulu or Paramount Plus or Peacock were all political ads. And it was just and it would be the same one because that one politician would say, well, I'm going to buy a whole bunch of ads. And I'd see the same person advertising over and over again because they had that money to do it. But when you watch news channels, whether it be Fox News, CNN, MSNBC, they still want that ad revenue because there are some people that still watch live news. And they're going to do the most sensational news story that they can so that people watch their station, even if they're not advertising, even if they're not promoting actual news. I mean, how many times have we seen retractions have to be printed because they posted a story before they even vetted whether or not it was real, but they knew that people would watch it. And so that in and of itself is a lack of common sense. I mean, you see people that are supposed to be educated and they're saying, well, we don't even know if this story is true yet. Let's just print it anyway. And maybe.
Well, you lose your integrity.
There's no integrity in mainstream media.
And I think this is something like if you don't stand for something, you'll fall for anything.
Yeah.
Right.
Great.
So like you need to be able, like whatever you are. Okay. You're a leftist news. I don't care.
Yeah.
That's the lane you're picking. Right. You're picking a lane. Now, as far as news, like, yeah, just tell the facts.
I just want the facts.
Everybody will interpret it through their own visor. Right.
And that's the thing. And so many people don't feel like reading it. I mean, the bill that was just passed, the $1.7 trillion bill that was just passed. Nobody read that. It was over 1,500 pages.
Do you know what it said?
No.
Okay, I'll tell you.
Nobody knows what the whole thing said because nobody's read all 1,500 pages.
Yeah.
And they throw these little things in there that say, okay, well, we're going to give $100 million to so-and-so's museum because they're my friend. And if you vote against it because that's in there, well, now they're saying, yeah, but we also had all this money for homeless children. So they voted against the bill. They hate homeless children. That's not the case at all.
Yeah.
Why not have... See, nowadays...
Well, let me tell you what the bill said.
Okay.
Okay, so I didn't read the bill. One of the guys I like entrepreneurs, right? And Patrick Bet-David, insurance guy. He's been on Rogan, but I watch a lot of his entrepreneurial content. Mm-hmm. Now he has Valuetainment. And they were going through it. Just, I think it's like a $1.7 trillion bill. I'm just kind of paraphrasing here. Okay. I don't know what it was. It's like $1 trillion is going to the Ukraine. Okay. Now let's break this down. $1 trillion to the Ukraine.
Well, they're getting another. I think it's another 45 billion.
Whatever they're getting.
Okay. But they've already gotten billions and billions.
Whatever they're getting.
But this is more.
Okay. And then it goes on to say, well, not $1 of this bill can be used for any of the border security of America. However, there are millions of dollars in that bill that are going to border security of the Middle East, I think Yemen, stuff like that. Okay, here's the thing. I'm not saying that the Ukraine shouldn't get help. I'm not saying that. What I am saying is that if you don't take care of yourself first, America, you can't help anybody else, right? So it's the same thing when we talk about like fitness, whatever. If you don't take care of yourself first, you can't be the best mother, the best father, the wife. You can't be the best husband. You can't take care of your children like you need to because you're not taking care of yourself. Right. You need to prioritize yourself first. You can't pour from an empty cup. So when politicians make this to take care of other countries, I'm not saying they don't need aid, but not yet. You need to take care of America first because we're crumbling.
Well, I did post something. I did do something like that because I just said, a friend of mine had posted something that said, so let me get this straight. So money for Ukraine is good. Money for America is bad. Guns for Ukraine is good, but guns in American hands are bad, and things like that. And I said, yeah, you need to understand all politicians don't care about, not all, that's an absolute. Most don't care about people. They care about votes. They just want the vote. So when it comes time for a vote, then they're going to give you this bill of goods and they're going to say, well, if you vote for me, I'll do this, I'll do this, I'll do this, I'll do this.
And do you think they do it?
And none of them do it. And then what happens? The next election cycle, they'll come up with a reason why they didn't. It was because of that party or it's because of this guy who voted against it. But if you vote for me again, I'll make sure that I do this, 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 and this. None of it ever gets done because they only need to do it. They only need to promise it when they're going to get the vote. And then I always wondered, when we're young, when we're kids, we don't know the concept of lying, right? We think that everything our parents tell us is the truth. Everything that everybody tells us is the truth. Then at some point in our development, we recognize that people have a capacity to tell us something that isn't true. And we realize that. And if you talk to any adult and you say, hey, do people lie to you? They'll say yes. But for some reason, no one wants to admit that their politicians or their news channels will lie to them. They think that the news always tells them the truth, and they think that their politicians always tell them the truth. I don't understand why. Because once you get power, people will lie, cheat, and steal to maintain that power. So they will tell you whatever they think you need to. I mean, people will say things about, regardless of party, people are called flip-floppers. Oh, he said this, and then he said this. He said that, and then he said that. Every politician does that. Whoever they are talking to, if they're talking to a group of teachers, then teachers are the forefront. We need to make sure that the education system is good. We need to make sure that you guys always have jobs and health insurance and this and that. If they go talk to coal workers, well, you guys are the future of the country. If they go talk to electric car companies, well, you guys are. We're going to get rid of the gasoline cars. But then if they talk to the gasoline companies, you guys are the future. It's always whoever they're talking to, that's who they're going to lie to because they want that vote. And then once the election happens, well, now they're going to push all that aside and they're not going to bring it up again until they need that vote again. So the giving to other countries and stuff like that, it's because that's the narrative right now is we need to help Ukraine. In this current instance, it's Ukraine. In the past, it was different countries. But again, like you said, we need to focus here first. We have homeless veterans. We have homeless people. We have people that aren't getting the proper health care. We have kids that are in debt because of college education that maybe they didn't even need, but they were told they needed that education to get a job. But nowadays it's like, well, you don't, because now you have a whole area of people, a whole group of individuals who say they never even went to college and they're making tons of money because they know how to work computers. They're better at, they didn't need to go to get that college education. They have life experience one way or another. Or when we hear this a lot, you don't have enough experience, so we're not going to hire you. It's like, well, how do you get experience? You have to be hired by somebody at some point. I always made a point of doing that. I always made a point of hiring someone, even if they didn't have any experience. I said, but how are they ever going to get experience? Somebody has to give them a shot. And I went off on a little bit of a tangent, but that's the thing is you have to take care of yourself. You have to take care of us as a country first, because we're just going to crumble.
Well, we are crumbling.
We are.
Right. I mean, there's no way about it. But now here's the thing. When it comes to politicians, a lot of them lack the integrity to stand for what they believe.
Right.
Right? Because again, I always think of it this way. If somebody gave you money that you didn't make or create, yeah, I'll give it away. Right?
Right.
If you're a businessman or you created that money or you did your blood, sweat, and tears to make something, you're going to be way more meticulous on what you do and how you do it.
Yeah.
Right? So like politicians who are just career politicians who just get elected, not a good fit. Right?
No.
Now, listen, we should all be taking stock trades from Nancy Pelosi because she's the greatest trader of all time. How does that happen?
It's amazing that someone that has worked at a job that only pays them $120,000 a year is worth $25 million.
There you go. So
$250 million. There's no way that happened without doing something on the side. Now, you spoke about the career politicians. When our country was founded, there were no career politicians. Every person that had an office, that held an office, had a job outside, and they would meet, they would create legislation, and then they would go back to their job. At some point along the way, it was, oh, I'm going to be a senator, and that's all I'm going to do. And then they would hold that job forever.
Because what else can they do at that point?
And they can't do anything else.
Are you going to go from a senator to go to work in a Costco?
Right. But what's crazy is, when I look at that and I say, okay, well, if that's your only job, why do you need to have a bill that has 50,000 things in it? I would say you're going to sit here all day and you're going to vote on each individual thing, because that's your job. That's what you're supposed to do. You're there for us. So spend all day voting all day. I don't care if it takes you 10 hours a day every single day. You know how many people work more than that? For way less money and way less benefits. Your job is to be here for us and advocate for us. So you're going to spend all day doing it. I don't want one vote and that's it, and then you go sit on your yacht. That's not somebody that I want representing me.
But the other thing is too that
no one ever. And the thing is nobody ever votes out income. That's why I at one point was telling people a couple of elections ago. I said, you want change? Every single person that you see on that ballot that has the little star next to their name that says that they're the incumbent, vote for the other person. Don't even look at what party they are. You want change, you have to get rid of the people that have been in there for 40, 50, or 60 years, because otherwise you're never, ever, you're just throwing good money after bad.
Yeah, but without term limits, they're just going to turn it into the same.
And they'll never have term limits because they're the ones that have to vote on those term limits.
But that's what I'm saying.
They don't want them.
And I think there's even a bill where like the Senate had to vote on if the Senate could trade stocks.
Yep. They vote themselves raises.
Yeah. I mean, that's great.
You need a president that goes into office knowing I am going to piss off everyone in Congress. I only want to be here for one term, but I am going to executive order term limits on everybody.
Well, term limits, but do what's right for the people.
Right.
Right. And here's the thing. If you're a career politician, you're spending money that's not yours.
Yep.
Right? You haven't built anything from scratch.
No.
You take a businessman or an entrepreneur who works 80 hours a week, who has to pay employees first, who, like, if the ship goes down, all your employees can go somewhere else. But you, my friend, go bankrupt. Right? Yeah. Like, you need someone like that who can take massive action, like that knows that, hey, if I don't get shit done, nothing's going to get done. The other thing is that politicians should have an amount they can spend on their campaign, no more. We're even.
Well, and then the problem with that is then they'll say, well, we can't have these ads because now the TV stations are charging too much for the ads. I'm like, well, then, make your ad better.
Get creative. No one gave me 50 G's to market my thing.
Right.
I had to make money somewhere else.
I had to figure it out. Right? Because wouldn't you want the cream to rise to the top?
Yeah. Right? Well, the other thing is that people should not be able to campaign for the next term while in office. I do not want you campaigning 2 years into your term for the next 4 years. I'm sorry.
Yeah.
Like that's doing something totally different.
There are so many, I won't say all, but there are so many that literally the second they get in office, all they're concerned about is raising enough money to win their next election. And you're right. They shouldn't be allowed to do that. They shouldn't be allowed to have campaign things like that, dinners and whatnot, because they are only focused on trying to stay in office. And that's what I said.
Then you owe everybody favors.
Well, that's the other. I mean, that's an entirely different.
But that's what happens.
You're right.
So, like, not only does the medical system have to break down, the political system has to break down.
Oh, yeah.
And put people in it who actually want what's best for America. And if you put what's best for America, you can extrapolate that and do what's best for the world.
Yeah, well, I mean, this world would definitely, I mean, the world has in the past, it benefits when America is succeeding. I mean, we are one of the youngest countries. I mean, we are a baby country when compared to other civilizations. I mean, we have only been a country since 1776. So you're talking, we're going to be approaching our 250th year. That's a baby country when you think of other countries that have been around for thousands of years. Yet we are for all intents and purposes, we are the most powerful country. I wouldn't say that we're necessarily the best because we're definitely lagging behind in everything from education to technology to health, happiness. But we are still extremely powerful. And if we are doing things the right way, other countries will follow suit. And right now they're looking at us and they're saying, this country doesn't know what they're doing. They're falling apart. They're actually dropping in rank on everything, yet they should be exceeding because they're one of the wealthiest countries. I mean, you've got single states in the USA that have more money than entire countries do. And if that country is doing better, when you look at those people, they might actually be happier.
Listen, if America was a person, I would be like, I need to stay away from that person. Because that person...
It's toxic.
It's toxic. It's falling down. Now, if I couldn't help them, right? Like if it wasn't my job to help them, but like if that was... I was like, I got to stay away from that person because they're in a downward spiral.
Yep.
Right? And the other thing is, listen, we're all humans. Like literally, we all want the same thing. To be happy, to be healthy, to have a good life, to create, to have friends. Like I would say 99.9% of humans want that. We all want the same thing, right? As humanity, we take each other forward. But like when you don't prioritize yourself first, you can't uplift humanity.
Right.
Right. And I find a lot of times, even with women that we do, the number one problem for people who see me, I would say, you can't say all.
Yeah.
But a lot of times they don't prioritize themselves enough.
Right.
They put everyone else first. You said the same thing.
I do the same thing too.
And one of the things that I've been really good about, maybe because I'm an only child, maybe it's because of the way I'm raised, maybe because I figured it out, is like I knew I had to take care of myself first in order to help other people.
Yeah.
Right. And as a PT, when you just keep seeing patients and patients and patients, and you care about them, it drains you.
Oh,
right?
Absolutely. I mean, that's something that I try to tell people, not because I'm looking for pity or compassion or anything. But I'll tell them, you don't get what the emotional toll or the mental toll is at the end of the day, at the end of the week, when you realize everyone that has talked to you all week has been complaining about something and you are having to deal with it. I cannot imagine what mental health providers are dealing with, because I'm dealing with people that are just complaining about physical stuff that I know, okay, we can fix. This is something that's more often than not, this is a fixable problem. You know, we can start to stretch this muscle, we can strengthen it.
But then the mental health gets affected too.
The mental health 100% gets affected. But someone that just has a severe depression or really horrible anxiety, and I do suffer from depression. I do suffer from anxiety, but not on the level where it's debilitating and I can't function and I don't leave my house. There are people that do that. I can't imagine the mental toll it takes on those providers to have to deal with that 20 times a day with 20 different people, 5 days a week.
For 40 years.
For 40 years.
Yep.
And it really does. It takes its toll, and it's hard to get out of that rut. Like I am drained at the end of the week.
Well, that's why you need to prioritize.
And I need to start prioritizing myself.
And I think that's one of the reasons why, one of the benefits you can take from the injury, which you kind of already talked to me about.
Yeah.
But I also think that you cannot live a fulfilled life without exercise.
You really can't.
100%.
I used to constantly joke that I didn't feel that way. Like I would exercise a little bit here and there, but I didn't make it part of my life. And I used to joke, you can't hurt yourself at the gym if you don't go to the gym. Because I would have so many patients come to me, I hurt myself doing this exercise, I hurt myself doing that exercise. And I would say, well, I don't do any exercise and I'm not in any pain.
Yeah.
So maybe just stop doing that and you won't feel the pain anymore. And I was just joking around. But then I started actually exercising. Like I said, before I got injured, I was getting up at 4:30.
How'd you feel?
It sucked getting up at 4:30.
Well, it was after working out.
But then I would get in the car at 5 o'clock. I would drive. I'd be at the gym by 5:30. I'd work out till 7 o'clock, shower, go to work. And I felt great. I felt healthier. Things were better.
And as a practitioner.
And I never thought I would miss over these last 2.5, 3 months. That's what I missed the most, is going to the gym in the morning and then going to work, because I just felt like I was starting my day the right way.
I think it's like a dopamine shield, right? Because you get the dopamine from working out, right? The runner's high, whatever you get. It goes over you. I work out in the morning. I can deal with stuff way better when I work out. I work out almost every day now.
Yeah.
And when I say work out, there's some days I don't have to go to the gym. Right. I just go, I do some stretches, I do some curls, whatever, because it's for my mental sake, right? But yeah, if anyone's watching this, if you're feeling down or your life's not where it's at, just start working out. Even if it's 10, 20 minutes a day.
I never thought I would say that.
Yeah.
But it is the truth, because that's the one thing I miss, and I can't wait to get back to it. Because I know that it's going to make me feel better.
You can still do upper body.
So, interesting thing, I can start doing some upper body stuff. I actually, maybe a week ago, I tried to do some push-ups. And I could do the push-ups. I couldn't get up.
Yeah.
Because I couldn't
just keep doing push-ups.
I couldn't rest my knee, my bad knee on the ground to push myself up with the left knee. But I couldn't if I put my left knee on the ground, I didn't have enough strength in my right leg to stand up. So I was stuck and I was on the ground, and I was like, okay, how am I supposed to do this? So I actually had to roll over onto my butt and then like grab onto a chair and like kind of lift myself up. But no, I do have to start doing more. And now I can do the bike. You know, as part of my PT, I have to do the bike. Matter of fact, part of my PT that I do at home is V-stepping.
Okay. Yeah, angle stepping.
Because I've got to start doing that again to be able to start moving. We have these Blaze pods. I don't know if you've seen these. They're basically just, my PT has an app, and it's just like flashing. Okay. And all I have to do is step on them. But you can do them for upper body. I see our OT.
I've seen trainers like soccer.
So it's really it's kind of coordinating my movement again, because I need to be able to start doing that. I need to be able to balance, putting on my sock and my shoe on my left foot. I used to be able to just stand on my right leg, lift my left leg up, put my shoe on. Can't do that. I can't stand on my right leg by itself for more than a few seconds before my balance is all off. So I've got to retrain all of that. And I can't wait to get to the gym to start doing it. I'm hoping that my next follow-up, he tells me I can start doing a leg press, because then right now I'm just doing weighted leg extensions. I want to be able to get on a leg press, even if I'm just putting just the machine with no plates, to be able to start pushing so that I know that I can put that force through the leg and it's not going to be damaged anymore, because I know that that'll build my leg a lot faster than just doing a 10-pound leg extension.
So that's a big thing too. So for women, strength training is hugely important because they have more at risk for osteopenia, osteoporosis.
Yep.
And so the way you get the bone to stay like strong and healthy is resistance training.
Yeah.
Right? Little tidbit, resistance training also burns more calories over time versus cardio.
Oh, yeah.
Right?
Yeah.
So like just the way, because the more muscle you put on yourself, right, the more calories you're burning at rest, take that over a longer period. Like I would say do both. But like the strength training will actually burn more calories over time than cardio.
And you know, and I tell people, you don't have to do these fad diets or anything like that.
You shouldn't do these fad diets.
You shouldn't do them. Really, all you need to do is burn more calories than you take in. And
like one of my coaches
your body will naturally start losing weight.
One of my coaches says, don't eat like an asshole.
Yeah.
Right? There you go.
Basically.
So let's talk about really quickly. We kind of touched upon it. Do you think college is a scam?
In a sense, yes. I think that paying too much for it is. I think that you have the degree. 90% of people don't care where you got it. You just went to a college and you passed. And, you know, one of the things that college kind of looks at, like if I look at somebody that they have a college degree, what that tells me is they're responsible enough to get up and go to class and follow instructions and complete tasks on time in a reasonable quality. That's what it tells me. So that lets me know I can give this person a task and say, can you complete this on time and will it be good? And if they've been able to do that for 4 years, then they should be able to do that with me. Does that mean that everyone needs a college education? No, it doesn't. A lot of time, you definitely don't need to spend a lot of money. You know, now I tell everyone, my advice is, if you absolutely want to go to a grad school and you need to want a graduate program, whether it be a doctorate or a master's or whatever, do not waste a lot of money on your bachelor's. Go to a community college, get your 2-year associate degree for as little money as possible. Then you finish it out, get your bachelor's at another location, but don't spend a lot of money, because then you will have to spend money to go to grad school. That's going to be your terminal education. That's going to be what you need to focus more on. But even that, you don't have to worry. You don't need to go to an Ivy League school. That's so that you can brag to other people, I went to Harvard or Yale or Cornell or Stanford or whatever. You don't need, most people aren't going to ask that, you know.
And you can't take that degree to the bank.
No.
The only thing you can take to the bank is your bank account.
Exactly.
Right?
And I remember my very first day of med school, he was like, the dean was sitting there talking to us, and he said, you know, when you're in high school, you want to get good grades because you want to go to college. When you're in college, you want to get good grades because you want to go to grad school. Now you're in grad school. Now it's important that you learn the material. No one is going to ask you, and he was 100% right. In my 15, 16 years of practicing as a doctor, no one has ever asked me what I got on a grade for a certain class. They know that I graduated, which means I finished. You know, the old joke is, what do you call the guy who finished dead last in med school? You call him doctor, because he's still finished. He passed all of the classes. That's what's important. Very rarely, you know, I couldn't tell you what school my surgeon went to. I don't care. All I know is he's a board certified surgeon. I know that he had to pass a whole bunch of classes to do it. He had to be competent enough that a hospital is willing to let him work there. And he had to be competent enough that this big giant orthopedic practice hired him as an associate. That's all I care about. I think that education is incredibly important. I always say, if I won the lottery, the first thing I would do is I would go get more education. I would want to learn more things.
But nowadays, and the reason why I asked you that question is, yes, if you want to be a doctor, or you want to have this pathway where, like, there is a terminal degree, you're going to be a physical therapist, you're going to be in whatever it is, you have to go to college. But for a lot of these degrees,
you don't.
How many people do we know have a communications degree?
Right.
What are you going to do with that?
Communications, liberal arts majors. I mean, you don't. They're so much in debt because they went to school because they were told they had to go to college. You can't go anywhere without a college education. Well, nowadays a bachelor's degree is the way a high school degree used to be. You don't. Almost everybody has a bachelor's degree, which means you're not going to be separated from anybody else except for what you bring to that interview, what you are as a person.
Right.
And you didn't. In some instances, you do learn. I think that college is important for everyone in that you learn who you are.
Yes.
But
and have the social interactions of people that age.
But I look a lot at myself, and I definitely didn't. I became who I am now more so over the last 10 years, really developing into the person that I am now, as opposed to when I was in my 20s. But I remember hearing something that said, good decisions come from experience, but experience comes from bad decisions.
Well, here's the thing.
And I made a lot of bad decisions when I was younger, just in how I treated people and how I carried myself. I learned over time what was more important, being a good person. I don't care if everybody likes me anymore. I mean, I still want people to like me, but I don't care if I'm who I am. If I'm,
true to yourself,
wanting to be true to myself, true to my morals, true to my integrity, and some people don't like that because I'm honest. I'd rather that than me supplant my integrity to please other people. And I think in my 20s, because you're in that college environment and you want everybody to like you and you want to be invited to parties and invited to things, you sacrifice some of your morals and some of your integrity so that people like you. I think that part of the college experience and that part of college, I think, is more detrimental to some people. And I would say you don't need to do that. I don't advocate everybody to live at college. I mean, it's nice to be able to learn how to live on your own.
I enjoyed it.
But in reality, I only lived at college for a little while, and then I lived at home, and I restructured my class schedule so that I could work 3 days a week. But it's the notion that you absolutely have to have a college education in order to succeed in this world is pushed upon by the colleges and the people that benefit financially from it.
Well,
and I think that's a problem.
And nowadays with the internet, there's great courses on wealth management too. How to start a business, how to be an entrepreneur, like how to do YouTube automation, like stuff that actually works.
Yeah.
Right. Like you have to invest in yourself somewhere, but not for everybody, especially nowadays. Do they have to go to college and spend the $100,000 to get that degree that they can never?
And then on the flip side of that, you have people seeing YouTube personalities and social media personalities that are making money hand over fist, doing absolutely nothing. And unfortunately, you have kids thinking, I can be the next person that does that. People will pay me millions of dollars to watch me play video games. And you have to say, okay, but you need to understand, just like professional athletes, there's a lot of people that thought they could be professional athletes, but they don't have everything to get there. It's a very finite number of people that are that good at baseball or football or basketball to be paid a ton of money, or even theater and acting. I mean, how many people are, the number of actors and actresses that make millions and millions of dollars is a fraction of the number of people that do that as a profession. So if you think that you're going to be, a YouTube sensation and make millions and millions of dollars, chances are you're not. So you need to have some education. You need to have some fallback. Yes, it's important to have that ambition and that desire, but you need to also have some.
Well, I would say
realism.
I agree with that, and
common sense.
I would say common sense definitely, but I would also say that if you follow your passion, you go that path, and you want to be a YouTube, you want people to actually watch you play a video game. Well, now we need business skills, right? We need marketing. We need a team, or you're going to video edit yourself, right? You need to be creative and be like, how am I going to package this footage? Right. So you could do that, but the skills that you have to stack on top of that, marketing, sales, maybe I sell a program now, how to play this game, right? You can grow that, but it's not one dimensional where I just post videos on YouTube and they watch it. Like you can expand it. And that's where it becomes more creative.
Yeah. Well, and you brought up earlier, one of the guys that you were watching, and you said that he was on Rogan. I mean, not everybody. There's 50,000 podcasts out there now. Not everybody is getting $100 million. There's not everybody is getting $100 million to do it like Joe Rogan is. Right. But he knew how to build the model, and he had all of this other experience in the past. I mean, his podcast is one of the best that I've ever seen because of how he runs it.
Well, I want to tell you, I think why his podcast is one of the best. Number one, he's real.